What I would like to do is to introduce my view of the shoulder and some common shoulder problems. Essentially, I'm going to be touching on 4 common problems that I see that probably comprise maybe 90% of the shoulder problems. They include stiff shoulders, also known as frozen shoulders, impingement syndrome or rotator cuff tendinitis, rotator cuff tears, and also arthritis. And I have along the way some suggestions and exercises and how to take care of your shoulder and some exercises that are commonly performed that can aggravate the shoulder. I think it's easiest for me to explain things to people if I can discuss the anatomy and have people understand the anatomy. And this is a picture looking at the back of a right shoulder. The shoulder is essentially comprised of a couple of important bones. You have the shoulder blade. The medical term for that is the scapula. Then you have the arm bone or the humerus right here. And those 2 bones represent the majority of motion and function about the shoulder. There are 3 joints located here. There's the AC joint right up on top, but the glenohumeral joint, which is the ball and socket joint, comprises the majority of motion about the shoulder. It is the most mobile joint in the body, and it is the function of that joint and the normal mechanics of that joint that allow us to have great function and pain-free function about the shoulder. When the mechanics of the glenohumeral joint are altered, usually because of a muscular problem, sometimes because of a ligament problem, but usually because of a muscular problem, then people develop pain. The other joint that's very important is known as the scapulothoracic joint, and that is the joint between the shoulder blade and the ribs, and that is very important as far as stiff shoulders and frozen shoulders and leading to mobility of the whole shoulder joint complex. The AC joint is a little joint on top of the shoulder. It is formed between the articulation of the top of the shoulder blade called the acromion and the clavicle. And it is a joint that is commonly arthritic in people over the age of 30. It's not a major player in causing pain, but it can be a frequent cause of pain. But when I say it's not a major player, the pain from the AC joint can commonly be treated with a simple injection of cortisone. But the main joint that we're going to focus on is the glenohumeral joint. This is a picture of the glenoid without the humeral head in place, and this is showing the labrum, which is the rim of cartilage surrounding the socket. Labral injuries are very common in teenagers and 20 and 30-year-olds, worker comp patients who are using a ladder, have the ladder caught by a gust of wind and wrench their arm. Oftentimes will have labral tears, which can be fixed arthroscopically. Some labral tears can be managed non-operatively. Labral tears don't lead to arthritis. They can cause pain, but they don't lead to arthritis, so I try my best to treat labral tears non-operatively. The important part of the labrum is that the ligaments connecting the ball or humeral head to the socket attach to the labrum, and there are 3 main ligaments. There's the superior glenohumeral ligament, the middle glenohumeral ligament, and then there's 2 parts of the inferior glenohumeral ligament, and these are the ligaments that get stiff when people have a stiff shoulder, and these are the ligaments that oftentimes cause pain when they get stiff when people have shoulder problems. So if you have a slip and fall on the ice or you aggravate your shoulder from doing too much painting, it's very common to see people get inflammation of these ligaments. These ligaments get stiff and thickened, and they cause pain, because that's a very common cause of pain that I see in people. If we go a little superficial to the joint, we get to the muscles. The muscles are what supply the power to the shoulder. In this picture right here, in the middle, you'll see a blue stripe. That's the cephalic vein. To the left of the blue stripe is the pectoralis major muscle, and to the right of the blue stripe over here, this with all these little nerves attaching, this is the deltoid muscle. And the deltoid is one of the 2 major players to the function of the shoulder, and it's very important. It is very rare for the deltoid to be injured, and the deltoid is the strongest muscle in the shoulder. And it wants to lift the arm and pull the arm up. And the only thing that's counteracting the pull of the deltoid are the little rotator cuff muscles, and that's what we're going to talk a lot about is the rotator cuff muscles, because the rotator cuff muscles have to counteract this big force of the deltoid. This big muscle here on the side, right underneath the skin that gives you contour, that's the deltoid. The little muscles that come off the shoulder blade are called the rotator cuff muscles, and there's 4 of them. The supraspinatus happens to be the one that's the most commonly injured muscle, And it resides right underneath the top of the shoulder blade, the acromion right here. And then there's two more in the back, the infraspinatus and the teres minor. So there are four little rotator cuff muscles that are very important to the function of the shoulder that come off the shoulder blade and attach on top of the humeral head. This is a battle between the deltoid and the rotator cuff. The deltoid wants to really lift the arm up and bring it out to the side. If you only had a deltoid, your arm would come up like this. And perhaps some of you know friends, or some of you have a shoulder that only goes like this. And that's because the deltoid is working and the rotator cuff is not counteracting the deltoid. The little rotator cuff muscles are able to work, so if you see the deltoid is acting with a vector that wants to lift the shoulder, the ball of the humerus up and out, and the little rotator cuff muscles act to suck the ball of the humeral head down and into the socket. So the subscapularis pulls it down, the supraspinatus helps pull it in, and the muscles, two muscles in the back, pull back down. So by having a functioning deltoid and a functioning rotator cuff, you can have a big powerful deltoid lift up the arm, and you can have the rotator cuff keep the humeral head centered on the socket, and that's how we have normal mechanics. Now we're going to talk about the four things we're going to focus on with this talk. What are things that are good to do and what are things that are not good to do? I'm a big fan of flexibility of the shoulder. A stiff shoulder is a painful shoulder. A lot of times people go to therapy and they focus on strengthening the shoulder, or they go home and they do a lot of strengthening of the shoulder, as doing a lot of push-ups or bench press, and that can aggravate the shoulder. I actually recommend that you don't do a lot of strengthening of the rotator cuff, but do strengthen the upper back muscles, because that helps normalize the mechanics of the shoulder and the shoulder blade and helps that scapulothoracic joint normalize its mechanics. And then the final thing we'll talk about is pain. Many times people say, should I be concerned about this? Should I be concerned about that? And pain is individual. I have people who have terrible problems who say they have a little bit of pain, and I have other people who have minor problems who have a lot of pain. But essentially, if the pain is waking you up, if the pain is preventing you from sleeping, preventing you from getting dressed, it's probably a bad problem. If it's something that just bothers you when you put a jacket on, it's probably something that's not going to be a bad problem that's going to lead to arthritis and a crippling shoulder problem. A very common problem that I see, particularly in women between the age of 40 and 60, is something called adhesive capsulitis, also known as a frozen shoulder. It seems to be more common in women. They present with pain at night. They present with loss of motion. It's also very common in people with diabetes. So the way I think to treat an inflamed shoulder with some stiffness, there's three ways of treating it. One is to stay flexible as best as you can. The other is to decrease the inflammation by taking anti-inflammatories. And then the third way is surgery. So stiffness is a major issue with patients with shoulder problems. So stay flexible, and I'll show you some exercises to do with that. These are good exercises that you don't really need a physical therapist or a doctor to kind of tell you what to do. The first exercise on the left is called pendulum exercises, where you just kind of let your arm be like an elephant trunk and just let gravity assist, just kind of range of motion. And many times after surgery or an injury, we'll teach you how to do pendulum exercises. But these are just kind of pictures and just kind of stretching exercises. You can do wall climbs, which is just kind of bringing your arm up against the side of a wall right here, reaching behind you with a towel. Any kind of exercise that you can do to keep the shoulder as flexible as possible. These are simple exercises that can be beneficial. If these don't help, you've tried these for 2, 3, 4 weeks and your shoulder still hurts, then we go and we try the anti-inflammatories.